Good morning, everyone. I'm Chloe Low from Group 8, and today, my groupmates and I will be presenting China's prevention and solution of poverty caused by illness and the long-acting mechanism, 防範化解因病返貧致貧長效機制. For brevity, we'll refer it as the policy or the mechanism throughout the presentation. I'll start by providing an overview of the policy, followed by Nicole and Beverly, who will analyze the policy's impact, and Christy, Ellen, and Adrian will conduct a health in all policies assessment. Finally, we'll wrap up with some recommendations and a conclusion. So, what is this policy all about? To better understand the policy, let's explore the key details using the 6W framework. First of all, where and when? This policy was implemented in China and published in early January 2023 by the Chinese National Healthcare Security Administration. The policy targets three categories of people. The first category includes extremely poor people and orphans. The second category includes Social Security recipients and rural residents within the monitoring scope. And the third category includes seriously ill patients with high medical expenses whose annual family income is less than 1.5 times the local minimum living standard per capita after deducting personal medical expenses. At this point, you may ask, why was this policy introduced, given that there are many poverty prevention policies already? The reason behind this is that the government recognized the need for more accurate and timely poverty prevention measures, in Chinese, 精准性 and 时效性. So the goals of the policy are building mechanisms, enhancing cooperation between departments, addressing shortcomings of current policies, and of course, preventing risk of poverty caused by illness. But how does the policy work to achieve these goals? The key actions include, number one, building a smart medical insurance platform for digital, convenient, and efficient service delivery. Number two, standardizing and simplifying the identification of unprivileged people with monthly update to ensure adaptability. Number three, conducting personalized household inspection to thoroughly understand each family's situation and accurately assess their poverty risk. And number four, establishing a medical insurance monitoring and early warning system. A yellow warning will be triggered if a person's medical insurance claim is above 10,000 RMB, and a red warning will be triggered if a total claim amount goes up to 26,000 RMB to identify individuals at risk of falling into poverty due to high medical expenses, which can ensure that they receive assistance in time. Now that we have covered the key details of this policy, let's pass the time to my groupmates Nicole and Beverly, who will provide an in-depth analysis of the policy's impact.
Thanks, Chloe, for the introduction. I'm Nicole, and in this section, Beverly and I will explore the policy's impact. I'll start with two socio-economic determinants. First, access to affordable health services of decent quality, which means that individuals can access necessary medical care without facing financial or logistical barriers. Let's take a look at the poverty cycle. Poverty creates barriers to healthcare access, trapping families in a vicious cycle. High medical expenses can lead to debt, which worsens health outcomes and perpetuates poverty. This policy addresses the issue through two key approaches. It expands basic medical coverage to as many people as possible, and also introduces a three-tier insurance system to support vulnerable populations, which includes basic, critical illness, and medical assistance. Together, these measures protect against large-scale return to poverty caused by illness. The second determinant is unemployment and job security. Illness reduces work capacity, limiting economic opportunities. Let's consider Xiaoting, who faces challenges securing a job due to post-polio syndrome. Through another poverty alleviation program, she became a toy designer. This highlights the need to go beyond healthcare financing and provide timely employment assistance. Proactive measures, such as job training programs in collaboration with local businesses, can help prevent families from falling into poverty. Adrian will delve into this further later on. While the policy offers positive outcomes, we must address potential downsides. Increased healthcare demand may lower service standards as people overutilize resources, and Beverly will expand on it. Additionally, a concern about fairness is raised, as some may feel discontent when they receive less support from the government, which could result in stigmatization, a topic Ellen will explore. And now I'll hand over to Beverly to continue discussing the policy's impact on individuals.
Thank you, Nicole. I'm Beverly. I'm going to talk about the policy's impact on individual health and well-being. Firstly, one significant outcome of this policy is the increased access to health care. This has led to higher treatment rates of common diseases and allows early control of infectious diseases like AIDS. Another focus is on preventive care. The policy encourages individuals to seek medical help early, promoting a culture of health awareness. In terms of affordability, by providing a wider range of treatment options, such as Western and Chinese medicine, patients can choose the treatment that best suits their needs. However, there are also challenges associated with the policy. Some may ask, will the quality of medical service worsen due to the increase in demand? To address this, investing in healthcare infrastructure and providing funding for medical staff trainings is important. Another issue is the risk of over-reliance on public services. Will the average waiting time be much longer? To mitigate this, community programs can promote preventive practices to avoid sudden overload of demand in medical services. Additionally, expanding the variety of medical services, such as online pharmacies, can alleviate pressure on physical healthcare facilities. In terms of individual well-being, the policy has significantly reduced financial stress for many individuals through medical insurance and subsidies. This financial support helps prevent families from returning to poverty, reaching the initial goal of this policy. 防範因病返貧. Besides, improved access to health care empowers individuals to return to work and have more control over their disposable income, increasing their living standards. Moreover, the negative impacts include the increased reliance on government support. To solve this for the long term, the government can provide vocational trainings and guidance for recovered patients. Also, the government should make regular reviews to adjust the level of subsidization. Another impact is the potential stigmatization and mental health issues. The government should increase public education to promote equity and encourage normalizing therapy-seeking behavior. Next, I will pass on to Christy to talk about the HIAP of this policy.
Now, let us evaluate the policy development in relation to HIAP standards. And today, I'll be focusing on the intersectoral collaboration. Firstly, the government and the public sector leadership and collaboration plays a key role in setting mandates. The policy requires public institutions to work with the government to employ people with disabilities. Transparency is also a key element, with a tracking system in place to monitor and publicly disclose disability employment data. Next, the collaboration between the private sector and the e-commerce platforms and major businesses focus on creating jobs for people with disabilities. The government also provides financial and operational support to help these businesses integrate disability employment. Additionally, these initiatives also encourage private companies to adopt inclusive hiring practices. The strengths of this policy includes its comprehensive multi-sectoral approach, fostering broad participation and resource sharing. The policy also includes clear and measurable targets, such as the goal of creating 1 million new jobs for people with disabilities. Additionally, there is also an expansion of employment services and social work, providing personalized job support and standardized services. However, limitations include financial sustainability risks with the potential for over-reliance on government funding and limited private sector participation. Social stigma and employment hesitation may still persist. While the policy makes significant strides towards inclusivity, addressing these limitations will be essential to ensure long-term success.
Now, let's talk about equity consideration. It's about ensuring that no one is left behind, especially the most vulnerable in our society. First, let's discuss inclusivity in coverage. This policy aims to ensure that all impoverished populations have access to basic medical insurance. It has achieved an impressive participation rate of 99.9% among poor populations. Next, we have targeted support for vulnerable groups. The policy implements specific strategy to address the health needs of disadvantaged groups, particularly those with chronic and severe illnesses. It includes tailored interventions such as the 3 batches of actions to allocate resources effectively. Lastly, let's look at the investment in infrastructure and capacity building. The policy makes significant investment to improve healthcare infrastructure in impoverished areas by strengthening local healthcare facilities and ensuring that each township has access to qualified medical personnel. The initiative promotes equitable healthcare access. However, there is one significant concern regarding the health and medical insurance poverty alleviation policy. Equity is not just about fairness. While the policy has successfully helped the vulnerable group access to healthcare, it raises concern about whether the individual who receives less support may think it's unfair to do so. Many people will only care for themselves, not for others, and even society. In the government's perspective and goal, it's not about everybody getting the same thing. It's about everybody getting what they need to improve the quality of their situation. Next, I will pass to Adrian.
Moving on to integration of health impact assessment, let's first discuss how HIA could be integrated. Firstly, we can have a baseline health assessment, meaning a comprehensive and continuous assessment of the health status to identify health-related problems and disparities. Then produce solutions via policy design, ensuring they address health determinants, for example, health care. Then we can implement regular monitoring and evaluation. This is similar to the previous point where we utilize HIA to monitor the health impacts of the program over time. Then adjust accordingly to maximize the efficiency and positive outcomes, as well as ensuring the money is being used correctly, since funding is quite limited here. Moreover, we can implement cross-sector collaboration. This is mentioned in the intersectoral collaboration part, where we promote collaboration between different sectors, such as education sectors, to provide knowledge to the public about health. We could also acquire funding from the private sectors, and hence we can better address social determinants of health. Well, what are the benefits? The health outcome could be improved since poverty is better acknowledged and better assessed. We can then implement and adjust the policies, and then create better health outcomes through baseline health assessment in the previous slide. Next, HIA can promote sustainable development, ensuring economic growth does not come at the expense of public health, as well as enhancing social well-being of the population. Equity is also one of the benefits brought by HIA. It was talked about in Alan's part, and it basically helps identify disparities and ensure the value of the program and that it is reaching the most vulnerable groups. Alright, there was a lot of content that we covered, so let's brief through what we have discussed. This was the policy we covered, launched in China in January 2023. We analyzed the policy's impact as well as the impact on individuals' health. So overall, even disabled individuals can live colorful lives like us. And healthcare burden is reduced. There are less people in hospitals now. Moving on to HIEP, we analyzed intersectoral collaboration, equity, and health impact assessment integration. Let's recall the case study. We looked at Xiaoting's case. We know that she got a job through a poverty alleviation program, but it was in a separate program than the one we are discussing. And since this program does not highlight providing jobs for disabled individuals, they might become too reliant on it and abuse the system to survive solely using the fundings and not do something for the society. Then the service standards would go down. So it is essential to offer job training or collaborating with local businesses to provide jobs and help prevent poverty. Now, equity is not just about fairness, and everyone has their own needs, but some might see it as unfair and might want more from others. There is actually no solution to this problem. We could mitigate it by using a hybrid approach, where let's say in this picture, everyone has minimum $1 each. However, the biggest problem out of all problems mentioned is of course financial sustainability risk. It is not hard to deal with as long as you have as long as they implement long-term planning and monitor to maximize efficiency and have enough budget from all sectors. But problem for me is I don't think that the government gave big thoughts when they designed this policy, since it only gives out money to build this, improve this, implement this, but doesn't generate much money. As I mentioned earlier, they don't emphasize on employment much. So it is actually a huge loss in the long term. It's to the point that I considered the possibility that this is propaganda. And the other recent source I could find on topics about poverty prevention program is one where President Xi visited a poor village in Chongqing. I don't think I have to explain the correlation between this and the word propaganda, right? And the only quote-unquote solution is to visit there and see for ourselves, create a documentary and expose the situation. And lastly, this is the reference list, and let's move on to the Q&A.